What is up, guys? Welcome to the Triage Method podcast. Paddy is looking different this week. He's no longer 6'5", and he's actually got glasses. So instead of Paddy,
Who
we've
said he's
actually.
not 6'5"?
You're
I
definitely
could be
not
six
six
foot
foot
five.
five. You don't look 6'5".
Damn it.
So
Not even on Zoom.
no, not even on Zoom. We replaced Paddy this week with Dr. Mike Banner or Banna. Eek. Um, so we've got a guest, Dr. Mike the Second, as he calls himself. So I came across Mike over the Instagram, as you do, and I found Mike to be a very pleasant person. He has a very nice approach to things, and in a time where social media is very much a case of shouting back and forth at each other, I think Mike is a voice of reason, the nice guy. So I said we get him on, give you a nice pleasant chat to listen to. So Mike,
Sickening.
how did you get here? Who are you? What's the story? And why are you Dr. Mike the Second?
Oh, sometimes I wonder how I got here. It's a bit of an odd story. Like I'm a GP down in West Sussex on the south coast of England. I used to be very inactive, very overweight, had no interest in my own health. Went on a bit of a journey of change, and through that journey, learned a lot about lifestyle change, behavior change. Just developed a bit of an interest in that kind of stuff. I like talking a lot, so I talked a lot about it on social media and things, and I used that as a bit of accountability. So I kind of just started doing a lot of social media-ing initially on Twitter, and then as Twitter got angrier and angrier, I moved over to Instagram. And then I've ended up doing some work with like the British Society of Lifestyle Medicine, where I'm a regional director. I kind of have a bit of an interest in trying to increase education for health professionals and for everybody around like lifestyle and the improvement of lifestyle, and that's about it really. I suppose the Dr. Mike the Second thing is just unfortunate that there's always someone who got there first, isn't there? And I think like everyone knows a doctor called Mike, everyone. And actually when I was finishing up medical school, I'm quite into music, as you know. And I used to go to a lot of like bar gigs and stuff. And I used to go and see a lady called Narina Palo play a lot. And I remember having a chat to her at one of her gigs, and she said to me, "Oh, like you're coming up to your finals, but this is fate. It's destiny, because my friend Dr. Mike is moving to America this summer. So seamlessly, you will take his place, and you will become Dr. Mike the Second." And she just started calling me Dr. Mike the Second since then. And then when I needed a nickname for social media, because I was like, oh, I don't want people to Google me and find out that all I talk about is cake in real life.
Yeah.
I was like, I need to have a slightly incognito name, and that was where it came from, really.
Brilliant. So you said you're a GP, and I actually wanted to ask about that because, like, so as our listeners will probably know, I'm a medical student, so I'm just at the very bottom of that ladder now, only a baby. But even as you enter medical school, I think a lot of stuff opens up to you that you may not have been aware of about medicine, how medicine works, different doctors, etc. And I think, like, when I speak to people from here in Killarney, and I'd say, I'm studying medicine, it's like immediately it's like, oh, you're going to be a GP. It's just assumed like you're going to be a GP because that's the doctor that they know. However, once you get into medicine, you realize that there's actually like a ridiculous amount of different specialties, and it's effectively just like an endless road of ladders you could climb if you wish to do so. So what made you wish to go down the route of GP? And also, what does that look like when you come out of medical school, and then like where do you go to actually become a GP? Because it's not just a case of you're out and now you're a GP. That's not how it works at all. There's expertise. So what does that look like?
I like to think there is some expertise. Unfortunately,
Absolutely.
not everybody is fully aware of that. So like, I remember actually having a chat to some medical students a few years ago and asking them what they were intending to do, because they were coming up to the end of their medical school. And they were talking about, I haven't quite decided. I'm not really sure whether to do medicine or surgery. And I was like, have you considered general practice? And the guy said, yeah, I've thought about it, but it just seems a bit like the easy way out. I don't think it would be challenging enough for me. I want to do something that like means something. And I was like, yeah, cool. Thanks.
Thanks for that. Yeah.
Thanks. And I think that, this is the thing, is like I think as GPs, you sort of develop this, you don't need to be the hero because nobody thinks you're the hero. Like there is a lot of feeling among kind of the general public that GPs don't do an awful lot, and because they're the most easily accessible, but they're also the most easily nameable, people get very frustrated when they can't get to see their GP, so they assume their GP's not doing very much. And when your GP has to refer you to a specialist, they assume that means that their GP can't manage things. And but it's just, there's a lot, it's like any career. And this is why I struggle a bit when people are so like angry about politicians and the people running countries and stuff, because I'm like, I'm not really sure that we really know how to run countries. Yes. And we're always like behaving like we would do it so much better than these people, yet none of us are actually the prime minister or have ever been the prime minister. So it's quite like, and I think that we don't always have that recognition that if you've never done something before, you don't really know how to do it, but there is this general feeling that you do. And anyway, to cut a long story short, the general practice is probably, in terms of specialties, probably the quickest route into actually completing your specialist training. And that, I'm not going to lie, that was one of the reasons why I chose general practice. I'd always planned to do orthopedic surgery. And I laugh when I say that because it's so outlandish as an idea, because I'm not in any way the character that normally would be associated.
I was going to say, I don't think you're like the stereotype, are you? The God complex with the hammer. Like
Exactly. But so when I was a medical student, I was attached to this orthopedic department. It was at the Royal Free Hospital in Hampstead in London. And I just had the best time with these people. These people were amazing, and they lived life the way I wanted to live life. Their ethos was similar to mine. They just had fun. They did this really serious, really important job, but there was always like laughter and enjoyment about it. And I loved that. And then when I qualified and started doing different medical jobs, I kind of realized there was a lot more to it than just bantering with your mates in the orthopedic office and going and watching operations. Like actually, if you wanted to do it as a career, you actually had to do the operations and the clinics and stuff. And that was a bit different. And it was just like the lifestyle in terms of stuff like surgical specializing, like you were talking about before. You can climb endless ladders to do things if you want to, but sometimes you don't have to. And sometimes, and I think for me, I didn't want to spend my whole life focused entirely on my career. And I think a lot of medical specialties do take things over in a sense. And when I did general practice as a junior doctor, and I just kind of fell in love with it. And I think if I'd been honest with myself, it probably was always what I wanted to do. But my dad and my sister are both GPs. And so I was absolutely determined to do something different and not just be like, oh, so you're just following in everyone else's footsteps. But when I did GP, I was like, nah, this is cool. I like the idea that anything can walk through the door. You maintain this total variety of what you get involved in, yet you still have the capacity to do sort of some sense of having a bit, specialist areas and things like that. And it just allows you to do other things with your life and your career that I think are harder to do in other forms of medicine. Like for me, like stuff like writing and podcasting and all of that kind of stuff that I love doing, I don't know that I would have the time or the capacity to do those things if I was, working shifts and stuff still.
Yeah. And is that what was the interest in lifestyle medicine something that emerged from GP, or more so from your own journey with trying to improve your own health, or both?
Definitely from my own journey, and then from the realization that the people in the medical profession or in the healthcare service entirely who are the most trusted in giving people advice on their lifestyle are probably the ones who are least well trained in actually coaching people, which is probably, the knowledge is secondary, I think. I mean, I think knowledge is important, but really it's stuff like coaching that is super important. And we don't do it, and we aren't trained really to do it. We're trained with communication skills and with consultation skills and with asking questions and establishing what's going on with people, but we're not well trained in coaching. And then the extent of that coaching tends to be stuff like, okay, you should lose weight, or you should exercise more, or you should eat less salt, and yet it's not this is how you will go about doing that. Let's work together to figure out what we do.
Yeah, and I think this is another case where, like you brought up earlier, where empathy is actually really important for like looking at the GP profession, but looking at the medical profession in general. Because what I hear from the personal training side of things a lot of the time, or the people who are just more into purely health and fitness, is they'll be like, doctors know nothing about nutrition or training, and they don't teach them, or they're not pushing this on their patients. But I guess when you actually look at the amount of time a doctor has with their patients, first and foremost, and also the other priorities that are there in terms of reviewing medications, reviewing symptoms, maybe trying to triage and see, is this an important problem I need to refer on with? If you're thinking about, I don't know, a subarachnoid hemorrhage or something, you're like, all right, sorry, but your squats are not my highest priority now, that kind of thing. I think being empathetic from a personal training perspective or a health and fitness perspective is actually quite important there, because you're already doing a lot of important jobs, and suddenly being a counselor for someone's behavior, trying to elicit behavior change in a 10-minute consultation or whatever, amongst all those other things, I imagine that's quite challenging.
Oh, absolutely. And that's why those things end up being an afterthought, because
Mhm.
it's kind of opportunistically going, oh, and by the way, it'd be great if you stop smoking. Oh, and by the way, it'd be great if you do this. But actually, that's not what that person has come to speak to you about. So they're not, when somebody comes to see a personal trainer, they're coming to them because they want to change their lifestyle. They're coming to them because they want to exercise, etc. Whereas when someone comes to see a GP, they're coming to them because they've got headaches or knee pain or back pain. And you've got to figure out what the actual diagnosis is, and then what the management is, and then what the lifestyle management is as part of that as well. You're right. It's no surprise that it sort of falls by the wayside. And that's why, even people who are, you've got me who's got an invested personal interest in it, but that doesn't mean that every other GP does. So they're not even going to do it as much as I do. And and what I do is minimal already, because again, like you say, you're spending the majority of that 10 minutes practicing the clinical stuff, and then the coaching, there's no time for it.
Yeah, no, it's completely understandable. And I think if like a personal trainer, or even an interested trainee who talks about this stuff, if they were to spend a week with a GP, it would probably really change their perspective. Because I think sometimes you can be, especially when you read statistics and see that, all right, the majority of the problems that we're dealing with are things like cardiometabolic disease. You kind of get the impression that, okay, so everyone that walks into a GP practice, they're coming in because they're overweight and they want to solve this, and their blood glucose is out of the whack or whatever. And then the GP is just saying, oh yeah, take drugs. It's probably not the reality, I imagine. So
No, exactly.
with that said, what does lifestyle medicine mean for you? What does that mean for you? Has it changed your practice? How do you conceptualize it in your own mind?
I mean, to me, lifestyle medicine is just always having in the back of your mind the intention to improve your lifestyle. And I think that's where, that's where a lot of people get it wrong, and it's so misunderstood, because I think a lot of people think that lifestyle medicine is having a perfect lifestyle. And I see you drinking Pepsi Max, and that is like a perfect segue into talking about the imperfections about what lifestyle medicine is about. Like, so,
Yeah.
I did a talk recently, and it was about Diet Coke and Ice Gems, because to me, that's what lifestyle medicine is. So to me, it's about taking somebody who is engaging in unhealthy practices, or engaging in whatever practices. We don't even need to call them unhealthy, but it's looking at whatever practices people are engaging in from a lifestyle point of view, and seeing if we can optimize those in any way. So for example, if somebody is eating a packet of digestive biscuits every day, and you switch them to eating a packet of Ice Gems instead of that, and you reduce the amount of calories, the amount of processed, you reduce the amount of calories and processed food that they're consuming by doing that. But a lot of people would be like, how can you advise people to eat Ice Gems? That's atrocious. When in reality, they're not getting that it's about moving in the right direction. Because if you try and get somebody from the letter A to the letter Z without working through all the letters of the alphabet in between, it's not going to happen. And I think if you consider the type of person we're talking about. So like the easiest thing for me to use as an example is my own like story. So if you take me several years ago, like I used to finish work and go to the pub with my friends, and I drank Diet Coke at the pub, or Coke. Like I wasn't there for the drinking, but while we were at the pub, I would have dinner. I didn't cook for myself ever. I would have takeaways or eat out or whatever. So if you then go from that to suddenly going, okay, from tomorrow, I want you to pre-prep all of your meals in advance, and I want all of your meals to consist entirely of plant-based, minimally processed whole foods. I'd have been like, yeah, cool, I'll
Yeah,
try.
cool.
Okay, bye. You know, it's just not going to happen. It's just too much change in one go. And so that's why it's so important to work with people and kind of make changes in the right direction. But it is a never ending journey. So like, for example, I may have lost a bunch of weight and my diet may be loads better than it was, 5-6 years ago, but there are still massive portions of my diet that are not healthy. And so there are still massive improvements that I can make in how I do things. So it's about always thinking. It's not about going, oh, okay, well, I lost 10 kilos, so that means I'm cool now. I can do what I want. It's about realizing that there are always improvements that you can make, and that journey is never ending. But you don't have to always make those improvements. There is this sort of level of moderation, which is totally fine. But if you want to keep improving, you can.
Yeah, I think that's really important as well, that last point that you made, because what I see, some people, and I've felt this in myself at times, where we put health as like this kind of central ideal, as if it's a god that we have to orient ourselves around. And this is fine if you're like, for example, some personal trainers and people who are quite into bodybuilding, let's say, like they will make every decision in their life in accordance with that ideal of, or in that case, it might be building more muscle, but it's all in some ways oriented towards health. So for example, what do you do before bed? If I ask you that question, what do you do before you go to bed at night? And then I ask someone who's a bodybuilder, and I ask an average person on the street, the person who's maybe a bodybuilder or obsessed with health, they're thinking about, all right, before bed, that equals sleep routine. Let's optimize sleep. Boom. Like everything is oriented towards that goal. It's the same when you look at a plate. It's no longer a food experience. A chef would look at a plate and see something very different to that a bodybuilder or a health obsessed person will look at the plate. And I think realizing that and recognizing that, how much the role that health plays in your life, you're actually allowed to vary that. Like you're allowed to accept trade-offs, while recognizing that, some improvements are definitely worthwhile. But what I often see, and what I felt myself moving towards in the past, is trying to just optimize everything, and then not being able to understand my client's perspective if they weren't willing to go to bed before 10 p.m. Like, why are you not doing that? Why would you not do that? And like for me, then it kind of caused me to reflect on my own life and think, well, Gary, you're willing to maybe do more exercise and types of exercise that probably put you at risk of injury. That's a trade-off in health. I'm willing to accept that. That's fine. I'm also in medical school while trying to run a business, and I probably don't sleep enough a lot of the time, and I'm probably more stressed than I need to be. Again, they're trade-offs that I accept in my health. But at the same time, I'm exercising regularly. I eat well. I try to sleep enough. So the word that you used at the start there was that intention to improve your lifestyle. And I think that is super important, that we focus on the intention to improve something, rather than saying everyone needs to have health at that center of their ideal. Because for me, that's just some sort of religion. That's not lifestyle medicine, I think.
And you also risk really struggling in the future, because let's say you're like that, you're making all these sacrifices, you're doing all these things for your health, and that's all you live for.
Yeah.
And then what happens if you get injured? What happens if you get a chronic illness that has nothing to do with your lifestyle? And then suddenly you lose your whole identity, because your identity is based around something that you have mainly because of your privilege. Like, we're privileged to have health, And that's why, like, again, from the other point of view, it's important not to take it for granted and to try and optimize
Sure.
it as much as we can. But at the same time, I think one thing that is so important for people to remember is that health isn't a binary issue. You are not either healthy or unhealthy. There is no food that is healthy or unhealthy. Everything has different qualities, different drawbacks, and it's all about everything jumbling together to make health. And how we measure health is also massively up for debate, because a lot of people, if we look at the health magazines from recent times, we would think that health equates to a spray tan, Photoshop, and six-pack abs, whereas in reality, that even the process of getting to that levels of health can have huge impacts on people's mental health, on their menstrual cycles, for example, and on their psychology and stuff, and in terms of what they are focused on in their lives. And we forget that health isn't just about one thing. It's not just about how much weight you're carrying. And it's not just about your blood pressure. It's not just about your cholesterol. It's not just about what diseases you have. It's about so many different things.
Yeah, and I think the ironic thing there is that putting that again, that health God at the center of your whole life and orienting everything towards that can actually have, paradoxical effects. It can compromise your health at times, because if you
Massively.
push so far in the direction of optimal nutrition, optimal training, etc., what you end up doing is compromising things like your social connections, your psychological
Mm-hmm.
well-being.
Mm-hmm.
Do you have a sense of meaning and purpose beyond just health? When you go to work every day, do you actually see a reason for being there? Are you happy there? Are you getting on with your colleagues? Or are you the person who's just sitting down with your Tupperware and not caring about anything else, because you're saying, I'm this lone wolf on this journey, man. Look at my macros, because
Yeah.
that's fine. And especially I think in your early 20s, like, because I definitely liked that when I first got into the gym. I thought that my own journey of just, improving building more muscle, training, etc., like, that was all that mattered, and that carried me forward for a while. But there comes a point where you're like, okay, I know it's healthy to not drink. Okay, I know that's generally healthful, but I'm actually not going out and meeting up with my friends anymore. That compromises your social support. I'm not actually having any enjoyment outside of the gym. Like, is that a good thing? And I started to call a lot of things into question. And I think psychologically, meeting friends more often, going for a few drinks every now and then, it's probably more healthful for me, at least, than being, completely abstinent as I was back then. And I think that's something that's difficult to see when you're on that path, when you're so focused on it. But if you can zoom out and detach, I think it does change your perspective a bit.
Because and I think there's fear involved in that, because I
For
think when
sure.
you are so focused and you are making progress, you're so scared of anything messing with that, and thinking that, well, what if things spiral out of control? What if I have an ice cream and spiral out of control? Like, what if I have a few drinks and spiral out of control? And I think everybody has different relationships with those things, and so has different sort of risk levels in terms of what that would result in. And also, I think it changes throughout your life. Like, I still also think, when I look back at times when I was a bit food obsessed, I'm still sort of grateful for that process, because it taught me so much about that process. Also, that level, I kind of think as well, like, lifestyle change is so difficult to make happen permanently, that I kind of sometimes look back and think, well, maybe you needed to be a little bit obsessed for a little while in order to actually make those changes bed in. But it doesn't mean I would recommend being that obsessed to other people. And I'm glad that I had enough decent people around me to kind of pull me out of it, and so that I didn't go down a path that could have potentially been quite dangerous. And that's why it's so difficult to give advice to other people on this sort of stuff, because I think these journeys are so personal. And in some ways, that's quite liberating from kind of a lifestyle medicine point of view, because you just think, well, people need to figure this out for themselves, and you can kind of assist them, but there's not always loads, I think, that you can do.
Yeah, and I think that's an important point, because again, it's just another case of, like, being empathetic towards others, because I'm sure you've seen this yourself, where there can be quite explosive debates between some people on Instagram in the like anti-diet side of things, and the people who are like more like pro calorie tracking, let's track
Yes.
everything,
Yeah.
and like almost always the person who's telling the other person from the anti-diet side of things, like, and there's valid points to be said there, what they're not realizing is that like you have spent 10 years tracking and then came to the
Mhm.
realization that tracking is not the way, and so that's, and personally, like, I don't track my calories anymore. At least I very rarely do, and I haven't done so for maybe 3 years or so. But I spent the first 5 years of being into the gym and training doing so.
Mhm.
I've been through there. I've been at the low points, I've been at higher points, and I've been, like you said, on that kind of spiral journey of improving your lifestyle, of being too obsessed at times, maybe pulling off the gas too much at other times. And the reality is that all of those changes bring lessons with them. And I think that if you're trying to start someone off on the point that you got to after 10 years of messing things up, we don't know that that's actually going to be useful, because I would find it very difficult to take a client on who I'm trying to help them with their nutrition and say, we're not gonna track anything. I just want you to use hunger cues. Like, for some people, man, that might be fantastic, it might
Mhm.
work, but everyone starts at a different point. People, as you said, carry different risks of different problems associated with lifestyle change. That includes nutrition. Some people can be too obsessive and it can become pathological at times, and knowing when to pull back is important. But
Mhm.
that point of empathy, again, is just so important, because people like you and me and anyone who's been in the game of trying to improve their lifestyle for 5 or 10 years, we are not at the same point of the person who's in their first year. And we need to understand that, and trying to walk in their shoes, it's difficult because your knowledge obstructs you from seeing it from their perspective.
And that this is the thing, is that on one hand we're selling people hindsight, and it
Exact.
doesn't
That's it.
always work, because sometimes you need to have hindsight to have it. But I think the other thing, like, about empathy as well, is that by definition, a lot of the things that, I say fitness people or people who are interested in lifestyle medicine, a lot of the things that they do are things that they've always done. So they are, a lot of people are personal trainers or are interested in lifestyle medicine because they've always had a passion or an interest in fitness. And I think that's when there's this huge gulf between you and the people that you're trying to help. And even with me now, because I've been doing things a different way for so many years, I've sometimes forgotten about that gulf as well, and about how, what did I not know at the time? What did I need? What would have been really useful for somebody to tell me 10 years ago? And I think that's what's quite tricky, because again, because you've been through this long journey, or it's just normal to you, you do forget about all of those steps to get there. And again, you're trying to get people to run before they can walk. And I think it's a really, really, really tough road to manage. And I think that we would do better to take more guidance from the people that we're trying to help. Um, and that's difficult, because I think it's often quite difficult for people to have insight into their own issues.
Yes.
So to understand their own relationships with food, or what works for them and what doesn't work for them. Because when I talk about, or when I used to talk about what worked for me, very different than what actually worked for me. It's just what I made up in my head. And I think that's one of the hardest bits about anything to do with fitness, is that like you're talking about tracking, for example. I'm tracking at the moment, and I have been for the last few months, because I had ended up putting on weight, wanted to lose it, had tried intuitive eating, but wasn't really all in. I'd kind of dipped my toes into it, but just enough to make myself put on loads of weight, because I had freedom to eat whatever I wanted and all of that kind of stuff. And I used it against myself, as I knew I would, because I was like, yeah, I feel my body needs food now, when actually it doesn't. Oh yeah, I think I just need ice cream again.
Yeah.
And it was more like, it was just one of those moments where that wasn't probably the right moment for me to do intuitive eating. And so I was like, right, I need to just get back on track a little bit. And I started tracking, and it's so comfortable for me to track
Yeah.
because I'm super experienced with tracking. I barely need to actually put it into an app or anything because I know what the calories are and everything. And at the moment, socializing isn't so much of an issue. Eating out and going out for drinks and stuff isn't really happening so much in my world at the moment. So actually, it's crazy easy for me to be adherent with it. But that doesn't necessarily mean that it's psychologically the best thing for me to be doing at the moment. Would I be better off working on, intuitive eating, working on hunger cues and all that kind of stuff? Probably yes. Do I save calories up for the end of the day so that I can eat a load of ice cream? Yes, I do. And, I recognize that these things aren't ideal, but you make excuses in your head
You do.
as to why it's okay at the moment, or this just is what works for me. And, I don't need to eat breakfast because I'm not hungry and it doesn't affect my performance. But actually, is it affecting my training? Would it be better off if I was having a protein shake in the morning, rather than using those calories later on for a Solero? Don't know, maybe.
Celeros are legit though. Like they're only like they're only around 100 calories, are they, or something
They
like
are 98 calories, sir.
that? Close enough. So obviously, like you've kind of walked the path like pretty far. You've tried the intuitive eating thing, you've done the tracking thing, you've successfully lost weight. I see you're exercising, albeit reluctantly with those those chain push-ups and stuff. But
Oh yeah.
what were the first steps for you? Like what was the one, like why did you want to change in the beginning, and what did you initially do, or who put you on the path? Was there anyone?
Yeah, so I'm going to be totally honest about this, and this is something that is difficult to say in the current climate. But I wanted to not be fat anymore. I wanted to look better. I wasn't. I don't know that deep down I was particularly bothered about health, but I did. The only thing that made me actually change was when I did start to get concerned about health. A friend of mine, who was a guy that he was older than me, in his mid-30s at the time, had a heart attack. Super fit guy, played loads of rugby, really, in good shape. And that was pretty terrifying. And I was like, well, like if this guy can have a heart attack, then what hope is there for me, the way that I live and all of that kind of stuff. So I was like, I need to change. But it was all about weight loss. It was all about improving things from that point of view. And I guess like the first step, I mean, I tried a bunch of different ways of exercising. So I tried cycling, I tried running, I tried walking, which didn't get me very far. And just started calorie counting. And I just didn't really get into any of those forms of exercise, to be honest. And I'd always kind of wanted to think about the gym, but the gym was like a too scary a place for me. It was like the idea of me going to the gym is just not going to happen. And especially like weight training, like that, it was so far off the scale. Like I had been to the gym, like when I was a medical student, I was put on placement in Devon, and there was only one TV for all of the people in the hospital. And I wanted to watch EastEnders, and other people in the hospital, for some reason, didn't want to watch EastEnders. Don't know why. So I joined a gym so I could go and sit on like the exercise bike to watch EastEnders on the like gym TV. And that was the level at which of how ludicrous it would be for me to even go to a gym like that. I joined the gym for the TV. So when it came to it, I was like, right, I need to do something. So I'm going to join this gym. But I feel super awkward about going to the gym. So I'm going to just do 15 minutes on the cross trainer and 15 minutes on the exercise bike. And I'm going to do that 3 times a week until I feel less weird about going to the gym. And then, I did that probably for a few months, and then it progressed to me using the rowing machine. And then I had this moment where I was starting to try and get better at rowing and to be rowing faster. And I rowed vigorously. And as I pulled back on the rower, I flew backwards, slid off the seat, and landed kind of, so my feet were obviously strapped in. My hand was on the floor. My other hand was holding the rowing bar. And I was like, what do I do with my life now? I'm stuck here for all eternity because I physically can't get up. I can't take my hand off the floor because it's the only thing that's keeping me up. I can't take my feet off these stirrups because I can't get them out. I can't let go of this bar because if I do, it's going to like twang back and alert all of these people to now look at me and start laughing at me. So this is my life now. I'm stuck here for the rest of my life. And when you've had that moment of like clarity of the world, you suddenly realize like this is rock bottom. I am like, this super overweight guy who also, by the way, it took me like, I was using the rowing machine so many times. And every time I would sit on the rowing machine and I would press all the buttons to try and turn on the display. And I would like be smacking it, be like, freaking turn on. And then somehow it would just turn on. And after I'd been using it like 5 or 6 times, I remember this like really in shape guy coming up to me and going, "Oh, dude, by the way, it just comes on automatically when you start rowing." And I was like, "Oh, okay, cool, thanks." That this was my level of cluelessness and my level of like embarrassing rock bottom, that I was just like, it doesn't get worse than this. So now I don't have to worry about what people think of me in the gym, because if anyone's already seen me, then they already think I'm a massive weirdo. So let's just go with it. And that's when I started to try weight training. And that was kind of what changed everything, because as much as I still am very reluctant with it, I just remember this feeling of thinking, okay, like when I do a 5K run, 2 minutes into it, I'm like, this is the worst thing that's ever happened to me. I hate it. I want it to stop. Why can't it stop? And I've still got 28 minutes left of this run to do. Whereas if I'm doing like 6 heavy squats and 3 squats in, I'm like, oh my God, I want the world to end. This is so difficult. How am I going to carry on? I've just got 3 left and then it's done. And then I get to stop and just chill out for a little bit. Yeah. So it was a bit of a no-brainer for me. And I had never really contemplated that would be, that was the one thing I'd never tried, because it was the one thing that I just assumed I would definitely hate and be terrible at.
Yeah, like if you don't like being covered in sweat all the time and just being like panting throughout the exercise, like weight training is actually pretty good, because you can actually just make the excuse that like, I'm actually just training for strength, so I never do over 5 reps, and like you're barely even out of breath during your workout.
Yeah.
And exactly. has it changed since? Like, do you enjoy training at the moment? Or you don't have to, but do you?
I mean, like I have a complicated relationship with training, I would say. Like I enjoy being someone who trains.
Yes.
I enjoy having trained. Like, I'm not going to lie, I look forward to the end of the session. I'm not sad when it's over, but I'm happier when it's finished than I am when it started. Mm-hmm. And so I think that training gives me a lot of benefits. But the thing that I still struggle with is enjoying the moment of training. So that feeling of feeling like, fatigued and out of breath, I still am like, oh, I just want to be on a sofa, I still just have that automatic want to like lounge. So I really like exercises where you lie down. That's great for me.
Oh man. But I actually do think, to be serious from what I do think that's actually important for people to hear that, because like what I hear sometimes from people, especially because like I love training, and that it doesn't have to be anything in particular, but like that feeling of like being really fatigued and sore, like I like that. I'm like, yeah, I want to feel like that more. Like but it's so cool. But at the same time, it's not. See, it sounds real hardcore when you say it. Like, I love that. I'm thirsty for blood. Like, it's not like that. It's more just a case of like, I like that feeling. I like knowing that I pushed myself, and the feeling of like coming to the end of a set and being, let's say you're on the 9th rep or whatever, and that's really hard, and then you do a 10th, and then you do the 10th, and I'm like, oh yeah, that was a great feeling, because you could have bitched out and stopped, and that would be a shit feeling. So it's more so like those kind of psychological back and forth.
I agree. I like that too.
Yeah, rather than being like, oh, I actually want my muscles to burn like this 24 hours a day. Like, no one wants that. If you felt like that without training, you should probably see a doctor. Dr. Mike II. But in all seriousness, like, because some people, I know there's been like more of a push from some physios at least to be like, oh no, we obviously have our exercise guidelines, but it's important for people to just find activities that they enjoy and just to do those. But at the same time, like, I think we have to understand what enjoyment actually is. And as you
Yeah,
said,
that's really
the,
tough, isn't it?
yeah, it's the pleasure that comes after that that can be counted as enjoyment. Like, it
Yeah,
doesn't mean that every moment of it has to be enjoyable,
yeah,
but when we actually measure enjoyment over decades, like, can we consider enjoyment of activity if you just barely do anything, and as a result you have too much atrophy and you have sarcopenia when
yeah,
you've aged, and that compromises your quality and quantity of life? Like, that reduces enjoyment of life
yeah,
long term. And if you actually think about not just before the session, during the session, and after the session, but also after the week, after the month, after the year, after the decade, I think enjoyment begins to add up a bit more. And I
yeah,
think the other thing is that you mentioned as well is you like the identity of being someone who trains. And I think that is so incredibly important. I don't know if you've read Atomic Habits by James Clear.
yeah. No,
You
I
probably
haven't.
have. Everyone's read it. But that's one of the points that he really, emphasizes is, rather than focusing, solely on the habits themselves, focus on the identity that's associated with it. And for me, that's something that I've really cultivated, like trying to be someone who enjoys the feeling of
Yeah,
suffering in the gym.
yeah.
Like,
But
if go ahead,
I was going to say, do you know what book I like even more than Atomic Habits?
go.
And I'm not going to say what you think I'm going to say. There's a book called Willpower Doesn't Work by Benjamin Hardy.
Okay, I haven't heard of that
And that
actually.
it's an incredible book. I would say it's my favorite book in that kind of genre of books, because it kind of makes that leap and that understanding that I think it complements Atomic Habits really, really well. Like, Atomic Habits is almost like a more kind of practical guide about how to develop this stuff. The Willpower Doesn't Work is all about kind of, curating those identities. And I know he's got a new book coming out that's about how, like, your identity can be changeable. Like, so a lot of people, because of these ideas, people put themselves in these boxes and these categories, like, oh, I'm just not somebody who does X. Like, they think that that's a personality trait and that isn't changeable. So if that had been the case, that's what I would have said ages ago. Like, I want to be someone who trains, but I can't be, because I'm not the kind of person that goes to the gym. And I think that's something that's super important for people to realize, is that actually we put a lot of restrictions on ourselves, and I think we do it because it's easier than not. And those restrictions stop us from achieving a lot of things that we want to achieve. But equally, I think that when it comes to stuff like identity and enjoyment, we have to remember that most of the things that we quote unquote enjoy also have parts of them that we don't enjoy.
Yep.
But we put up with those parts because we enjoy the bits that we do enjoy. And it's the same, I think, with exercise. Like drinking, for example. Nobody has ever enjoyed a hangover in the history of the planet.
No.
Yet somehow drinking is the most popular form of enjoyment, like, of any that I know among most people. And nobody is like, I mean, how have people not decided to stop drinking because hangovers are so awful? How have people not decided to stop giving birth because, like, labor is so awful? It's because the other things give them that enjoyment, and to them that enjoyment outweighs it. And so that's why when people are saying stuff like find exercise and find activity that you enjoy, it's finding stuff where the benefits outweigh the
Yes.
disadvantages. Like, and that's the thing in life. But those benefits don't have to happen at the time, and the advantages don't have to happen at the time. And I think that's what people forget and don't realize. But I also remember people telling me, oh yeah, just keep running. Like, eventually you'll just become like addicted to it, and it would, because it's so addictive. And I'm not kidding. I ran 3 5Ks a week for at least a year, and I hated it just as much at the end of that year as I did at the beginning. I was like, this is so awful. Like, there's nothing good about this.
Yeah, no, I think that is important too. That's an important distinction, because, like, while it's okay to kind of be like, oh yeah, I don't really enjoy this, but I'll embrace the suck. Like I definitely have a bias towards that mindset, but at the same time, like if you run 3 5Ks a week for a year and you still have absolutely no interest in doing it and it
Yeah,
feels horrible, like there's surely something better. There's probably something
exactly.
else that you could do, or at least diversify it a bit. Like maybe it's the case that Monday you do your 5K, great, that's out of the week, or
Yeah,
that's out of the way, and then maybe a bit of weight training on Wednesday. Like, yeah, I still don't love it, but it's a bit of a change, new environment, etc. And then maybe on a Friday you do something that's group based, and group based activities I think could be particularly useful for fostering that kind of that identity. Like
massively.
this is an interesting one because it probably counters a lot of like other medical student experiences. But basically, like, what we've done in our class, it's really interesting, is we've got a WhatsApp group that's like, it's titled the mediocre gym goers, because basically I call us all mediocre gym goers. But there's a chat. It's about a third of the class is in that chat now on WhatsApp. And basically what happens is, yeah, every morning at maybe 7 o'clock or 8 o'clock, depending on the time, it's COVID slots at the moment, basically we go and we train before college. So people get into the gym, everyone's up early, you're into the gym before college, and you only get into the chat if you've shown up twice in 1 week. So you show up twice in 1 week, boom, we add you to the chat, and then you stop showing up, you get kicked out. So we've actually got this, like, it's like this amazing social proof, where it's like, oh yeah, we're all medical students, but we go to the gym. Like that's what we do. We get up in the morning, we go and we train. So then when you wake up in the morning and you're feeling tired, you're like, oh, I don't want to deal with the stick that I'm going to get in the chat. So, I'm actually just going to go. I don't feel like it, but I'm going to go. And then afterwards, you're like, oh, I get to give other people a stick because they didn't show up. Like, where were you this morning, Mike? So it actually becomes like more of a novel thing. But in all seriousness, like I've obviously been the person who, or me and a few others, would have like always gone to the gym. But it's been interesting to see how people who maybe wouldn't go to the gym that regularly, or they'd be unlikely to show up at 7 o'clock in the morning, how consistent people have actually been just as a result of that, because there's something else. There's an identity component built
Yeah,
into it. And like, if you can build that out yourself with, I don't know, friends that you have or your family
yeah.
members or whatever, like that's quite powerful when you add it up over years, because
Oh, it's
especially
huge.
in something like medical school, where you can, once it gets stressful, it's very tempting to just eat chocolate and not train and stay up all night and drink coffee at 4 in the morning, that kind of thing.
Mm.
Like that's something that could potentially really improve the health of different people within the
Yeah.
class or whatever, that may not have otherwise gone to the gym. So it's not a miracle, but I think bringing that social element in can be quite powerful.
Yeah, yeah, exactly. Like that was massive for me with my sadly now closed down gym. Like that was the biggest thing I think that made the changes for me, was having that like community and having those people, like being, the early morning Metcon club and all of that
Yeah.
kind of stuff. And it's just it's super powerful. And I think that's again part of it is finding what it is that keeps you interested. Like you have to find something that keeps you interested, otherwise you won't carry on doing it.
Yep, and there might be a little bit of suck along the way. You might
Yeah,
like doing your push-ups with your chains, but it actually is cool watching some of your videos that you do put up, though, because I think it's good for people to see that, like Mike's complaining, like Mike's giving out to you're
yeah,
giving out to your personal trainer. You're like, I don't want to be doing this, but you are doing it anyway. And
yeah,
you kind of step back at the end of it and you're like, yeah, that's just what I do. I show up to the sessions. I don't necessarily like them all the time, but it's still a case of that being your identity, and that contributes to your health. And that's something
yeah,
that carries over long term, because we're not all going to be obsessed gym freaks who, are always on the motivational high and pushing everyone else. And that's okay. That's fine.
yeah. I have a really interesting relationship with positivity and with all that kind of stuff, because I think again what I worry about with my with exactly what you said, and I've reflected on this quite a lot, is am I then creating an identity of failure? Am I creating this identity where I complain all the time? Am I stopping myself from enjoying it because I'm complaining? And I go up and down on it a lot. And it was interesting because I think that started to happen fairly recently. I think that there became a point where I was like, you know what, um when I post videos of me being shit at exercise on Instagram, I get a lot more positive feedback than I do about posting videos of me being good at exercise and doing proper reps. And you know, like, not that I really ever did that, because I'm like, who wants to see videos of me doing exercise? So I made this very conscious change where I was like, I will complain if I want to complain. However, I will not do an imperfect rep. And if I do, I will do this, you know, like I will do it again. I will change it. And I made this sort of pledge with my coach, really annoyingly, because he reminds me of it every single session. And I was just like, I'm not going to accept mediocrity. I might complain and I might whinge, but I have to do it properly.
Yeah.
Even if I complain the whole way through it, I want my depth on my split squats to be perfect. I want my, you know, I want my push-up form to be perfect. That's a non-negotiable at this point now. And if it involves me having to work harder, then that's just what I'll have to do. But, you know, like to use the term you used earlier, bitching out of it because it's funny for Instagram is not who I want to be.
Yeah, no, that is really important, because there's actually a guy like similar to yourself who goes to the gym every morning with us, and he's so consistent, but he's the type of guy who, like, he does it because he knows he needs to do it, and he feels better for it. But at the time, he's like he'll like look at me on the assault bike or something, and he's like, "You're sick." You know, he says, "You're a mentalist." That's his phrase. He's from the UK, so I don't know if you guys say that, but "You're a mentalist" is what he said. Like, you actually like this stuff. But his whole thing is like, I do not like this, but I'm going to do it anyway, and that's fine. And I think that's incredibly positive, because, you know, he still has some sort of a positive attitude towards it. He's still showing up all the time. He knows he feels better for it. It's making his life better. And for me at least, I think it's really good for me to see those types of people, because I end up like, my bias is to kind of even caricature my personality sometimes, to be like, yeah, let's all fucking train all the time. It's too easy, you know, that kind of thing. Like, let's go, guys, let's work harder. Like,
I've seen your assault bike sessions,
yeah,
to be
like
fair.
that. But that type of thing, like, I kind of mess around with it on Instagram, and like, oh yeah, I'm sitting on the toilet recovering, it feels so good, like, you know, that kind of thing. But like that, but it's good coming from that perspective to see other people who are like maybe being more negative about it, but not pushing it too far to the other side of the spectrum. Because if that guy that goes to the gym, if he was always like, oh no, I don't want to go to the gym, I haven't gone in a week, it's so shit, I don't want to do anything, it's just boring, like, I'd have no time for that. But I do definitely have time for that more balanced perspective, like you said.
Yeah. And I think it's fine. It is, you've got to find that balance between, you know, finding it uncomfortable, but it being good for you and you ultimately enjoying that, and hating it so much that you just never want to go back. And I think that's one of the things that is hard to achieve. Like the first coach I worked with, at the end of every single session, I was totally destroyed. Like I was, and part of that was because I was starting from a place of minimal fitness, and the progress I made in that time was phenomenal. But every session would end with either like heavy prowler or sled push, heavy like watt bike session, like sprints, like to the point where, you know, frequently I would have to sit down with my head between my knees for 10 to 15 minutes before I was safe to drive home after the session.
Yeah.
And I think that, you know, there's something to be said for that, because again, you feel a bit like, you feel like you're working really hard, and that's really cool. But also it is hampering your performance in other ways. Like I would do that session and then I would be on the sofa for the rest of the day. You know, like I would then do nothing. I would then not be able to, you know, barely go out for a walk. I'd have the DOMs for the next 3 days where I could barely do anything. And, you know, when you think like what your actual goals are, that's not necessarily ideal. And I think it brings us back to that thing that we were talking about people sort of seeing that religion of health, where that's the only thing that they're focused on.
Yeah.
And I think it introduces, like, I'm sure that you've reflected a lot on like the morality side of like training and fitness, and how like the martyrdom, that it has so many parallels with religion. Like the suffering is so important to people because it makes them feel like they're superior to everybody else. And then they can look down on those people, and they don't even realize that they're doing it. I didn't realize I did it at the time. You know, I would post pictures of my disgusting food on Instagram, but I would be so proud that I was eating just tuna out of a can with some pepper, because that was what it takes, you know? And it was like, I'm sure that other people would look at that, like while eating their donut, and go, oh, feel a bit bad about themselves. And that was never my intention, but I'm sure that that's kind of what it did. I think that morality aspect is one of our biggest challenges. I don't know what you think about that.
Yeah, it's actually something I was only talking about this with a friend the other day who like this was actually one of like you're going to mock me for bringing this up, but it's actually one of Friedrich Nietzsche's criticisms of Stoicism was the emphasis.
Oh, have you heard of Nietzsche?
I heard of him once or twice. Yeah,
Mm.
he's one of his criticisms of Stoicism was basically the ascetic elements of it, and asceticism basically being voluntary suffering, and the idea like that you just kind of remove all pleasures and just make life hard. But Nietzsche's criticism was that if you're making life hard just for the sake of making life hard, that is another example of a human's will to power, which is Nietzsche's phrase. And will to power in this case being, let's say one example would be external, so inter-individual. So my will to power over you would be me showing you how much power I have over my hunger, over my control, over my desire for pleasure, by saying that, hey, look, I'm able to eat tuna and peas and I don't need anything else. Like, look at you, you're such a bitch, And that's kind of the
Yeah,
approach that some people have. And like,
yeah,
that is just, that's an example of, me projecting my will to power. Whereas then there's also an intra-individual element to it, where if I can show myself that I can overcome all desire for pleasure, I feel more powerful because
yeah.
look, I overcame the desire for the donut. Yes, I could have had it, but I overcame that desire. And
Mm.
for me, there's a fine balance to be struck there, because I think our desire for control and certainty as humans is understandable in that like, you don't want to feel chaotic. Like, I don't want to feel like I have no control over my food choices or
Yeah.
what I do every day. That's a horrible feeling. You want to feel like you have some control. But if
Mhm.
all you're doing is exerting control and exerting that will to power for its sake as its own end, I think that can potentially become pathological. And that would be the type of person who goes to the gym just to hurt themselves, and the outcome is the soreness. That's where it becomes more pathological. And that's what a lot of people do. They measure the success of their workouts by how sore they were, or they measure the success of their diet by how little pleasure they get from it. Like people
Yeah.
who voluntarily will avoid things like artificial sweeteners, or some sauce on their chicken, purely because it feels more hardcore. And for me, that's where the kind of, that you could call it a moral element, but that's where it becomes a little bit more pathological, I think, where it's asceticism for asceticism's sake. And
I agree.
that would be a criticism of Christianity and religions in general, sometimes as well.
So where do you fall on, like, so for example, I often reflect quite a lot on, when you look at things like the supplement industry and you look at all of the minutiae that people do. We did actually a podcast with Luke Hoffman from Muscle Mentors about this, and about kind of people using supplements and people using uh, I don't really know what to call the collection of stuff, but like, like blue light blockers,
Yeah.
grounding, all of those like peripheral things, like the tracking of all the logs and all of those sorts of things that people kind of obsess about, these fine details about things. Um, do you think that comes into it as well, like that? Because I sort of equate it sometimes to that feeling like when you really want to pass an exam, the first thing that you do is buy new pens or something, because you
Yes.
kind of, it just renews, like just putting some money towards something or buying a new thing makes you like feel like you're investing in that future. Do you think that's the sort of same sort of thing, or do you think it's more like a suffering thing, like trying to make every aspect of your life be about health?
Oh man, I love that point. And because this is actually something I think about with every single area of my life, whether it be studying or gym or whatever it is, that like, because I was so guilty of that in my earlier years of health and fitness, of like just trying to do everything for the sake of doing the things, whether or not they actually benefited me. Like back in the
Mhm.
day, things like intra workout supplements and just taking lots of different supplements, like having a pre, an intra, and a post workout supplement, and being super precise about all that stuff. Like that was all the rage. And it gives you this feeling that, hey, look, I'm doing more than I was doing previously, or I'm doing more than everyone else is doing, and as a result, that makes me better. And you measure your outcomes, or you measure your self valuation, you could say, by what you were doing rather than what you're actually getting from it.
Mhm.
So, for example, if I have a pre-bed routine that lasts an hour and a half, and it's compromising my relationship, but I go to bed thinking, yeah, what does my girlfriend or boyfriend, she doesn't get it. She's not like me. She doesn't understand. Like,
Mhm.
that again is just you kind of exerting some sort of self superiority, even though if you were to measure like all of those elements from a moral perspective or whatever, you could actually be like doing pretty bad things. Like, that's not
Mhm.
necessarily a great way to live your life. And I think they're good examples of things like, I think things like grounding and blue light blocking glasses, etc., etc., all these different things that creep into your life as kind of peripheral things that like probably aren't going to have massively meaningful effects, maybe for some people in some cases, but doing all of those things and especially posting them on Instagram, which is what most people do, it's again showing like, hey, look how in the game I am. Look how much I'm doing. Look how in control I am of all of these things. Like you, Mike, you're training and you're tracking your nutrition, but you could be doing all this stuff as well.
Yeah,
So you better get in the game, bro, because I'm in the game. So
exactly.
yeah, it's something that I'm mindful of, and like the studying example as well. That's another one. If you can have all the perfect notes, you can have the perfect pens, you can have the perfect system for note taking, etc. But at the end of the day, it's your knowledge and or competence that comes out of that actually matters. So for
Yeah.
me, I try to focus far more on just like, how are you actually doing? Because it's
Mhm.
just feelings. It's short-term feelings. It's like motivation that you get from those pens and stuff. It's like when you watch a video before the gym and it gives you this big shoe up the arse, or you watch it on a Sunday evening being like, this is going to be the week. And you
Yeah.
repeat that every week. It's just a feeling. That's all you're seeking. And it's like some sort of self-validation, but it's not actually taking you closer to the outcome that you should be
Yeah.
desiring, I think.
No, I agree fully.
Yeah, you could explore those topics for a long time, especially their moral elements. I think if Friedrich Nietzsche was alive today, he'd have a lot to say about our approach to health. But
Oh,
maybe not.
definitely. And it's interesting that we don't really have, like, where are the philosophers? They're on Instagram. Like, that's all we have now. We don't have, we don't have those people to actually make comments on what's happening. I guess we have people writing books and all that kind of stuff, but it's not quite the same, is it?
Yeah, yeah. That's why you got to read old school stuff, man.
Yeah, I
You read the
know.
old books.
I know. I'm still. I just feel like, and this is the reason I made the comment earlier for anyone who's listening that thought I was taking the mic. I wasn't, but I really struggle with serious entertainment. So when in my mind, I've spent my whole life reading books because I've had to read books,
Yeah,
and spending all day at school or university or medical school or work doing really serious stuff about really in-depth, intricate, thinky things.
yeah,
So when I finish, I want to watch like the worst TV you can find, the worst films, and I want to read books by the worst people if I'm going to read anything at all, and it will be an audiobook. So, like, how do you maintain an interest in the serious stuff? Because in some ways, like, I find little tidbits of information, like I find that what you just said really fascinating, but I also would find it really difficult to motivate myself to go and read that actual book.
yeah. Well, first of all, what age are you, Mike? You can give us a range if you don't want us to say it.
I'm in my 30s.
You're in your 30s. Yeah, so I'm 25. So, I mean, I think that's the first thing, is that like I'm quite young, so I always like to think that okay, I could be actually way different when I'm Mike's age. When I'm an experienced GP, experienced doctor, whatever, I could have a very different perspective on things. But at this point in time, I think I'm very much in that stage of my life where like, let's get after it. Let's do all the deep, intricate stuff. Like, I don't need Jessica Simpson audiobooks to keep me happy kind of thing. So I'm not a very leisure kind of person, just watch things just to calm down. But that could change. I don't think that's necessarily helpful all the time. So that's my first caveat. But in terms of like why I like to kind of read about philosophy and that those types of things, because it's kind of like what we just said, is that we actually end up talking about these things and thinking about things like morality and the meaning of life and how to live a good life. Like we talk about them all the time. Like everyone in Instagram talks about how to live a good life. And
Yeah.
I think reading things like philosophers who were around 100, 200, 500, 1000 years ago, and you see them asking the same questions, it's like, it kind of gives you this sort of intellectual humility where you're saying, I probably don't have the answer. Okay. It's very likely that I don't have the correct answer and that I could be living in a way that is potentially better, or a way that is potentially better for the people around me. And I think if you're solely focused on, consuming Instagram content, and you're listening to your favorite influencer talking about, what the next step to improve your way of life is, and you read things that are talking about similar questions for 2000 years, you're kind of like, maybe there's more to this. Maybe there are different questions I should ask. Maybe I can learn something from people in other cultures, people who spent decades writing about this stuff. And very often you will. And I think because, especially in philosophy, there are such fundamentally human questions, like what does it mean to live a good life? Like it's very difficult to answer that, and people have spent decades contemplating it, and exploring it. And yeah, I like to read their thoughts, because it stops me from being, I think, letting my own ego just kind of take charge and ascribe the meaning of life to myself and others.
Yeah, I think it's a good thing to do, and it interests me because I see this a lot with, a lot of young people now. When I was in my early 20s, like it would, like, and this is the one thing that I think Instagram has helped us with a little bit. Like, um, I don't think self-development was big when I was growing up, or certainly wasn't massively accessible. Whereas now, a lot of, I mean, even unless you follow the most kind of basic of people on Instagram who just post selfies all the time, which I don't know if I'm just in an echo chamber or a bubble, but I feel like most of the people, even people in an industry that's somewhat superficial, like the fitness industry, people are still talking about self-development. They're still talking about business development. They're still talking about, reading books and all of these kinds of stuff.
Yeah.
And so you're having like people in their late teens, early 20s, reading books like Atomic Habits that, I didn't get to until very, very much later than that. And I find that really fascinating. Like sometimes I think if I had been aware of all of these concepts when I was much, much younger, I wonder if I would have ever have needed to do so much work on myself so much later down the line. Does that make sense?
Yeah, no, it absolutely does. And I think that's one of those things where I think there's pros and cons to it. I think there's pros and cons to being obsessed with that kind of self-development thing, because what it also does is it gives you hundreds of different paths to choose from, which could potentially be detrimental if you're already on a good path. Like in your
Yeah.
case, right, you were at medical school, you were like, all right, I'm going to be a doctor, so every day, you wake up and you're like, okay, what do I need to do today to be a doctor? Cool, let's do those things. Very simple. Whereas now it's like you're reading a book and it's about this person who's talking about chasing your true passion, and they're like, were you unhappy when you woke up today? And you were like, yes, we're doing neuropathology. How could I be happy
Yeah.
about that? How could I be happy about that? And you're like, okay. And the next thing, the self-development books start telling you to move to Thailand and start an
Yeah.
internet business, and I've been there, man, because I've like, for me, the working online and being financially independent from online business, that came before the medical school. So I
Mm.
think I'm in an interesting position where it's like I've felt all those outcomes of like being financially independent, being able to work anywhere, being able to, travel if I wanted, and that just not being a big deal. And I think it's interesting because I think philosophy was actually what probably led me to thinking really deeply about like why is that good? Yeah, it feels nice. It makes good Instagram content. People love to hear it because it's like you can escape your everyday life and live on your
Yeah.
laptop. but the reality is often a lot less sexy. And I think this is what I feel sorry for people who are 17, 18, 19 now growing up, is that you're actually being given countless different potential paths. And it's really difficult to see what the good path actually is,
Yeah.
because like your own valuation of again, what it means to live a good life, or what it means to be happy or whatever, like that can be influenced by countless different people, potentially thousands of people, depending on who you follow. And like, what's the right answer, you know?
And that's a very, very good point. And I think that probably in some ways, though, by having experienced that yourself, it probably will make your decision to go through medical school a lot more powerful. Like
Mhm.
I probably spent most of medical school doubting whether or not I was doing the right thing. And also perhaps if I'd read a book at that point and learnt about the sunk cost fallacy, I'd have left
Yeah.
medical school, or I'd have left medicine. Like I remember being in I remember qualifying, being 6 months into my first junior doctor job, and having to move to Luton. I don't know if you've ever been to Luton. It's not the loveliest of places. And actually I grew to absolutely love it. But I remember in the first week thinking, oh my God, what have I done with my life? I hate it. I hate this place. I'm here. I hate my job. There isn't anything like this. This is awful. What have I done? I've wasted 6 years of my life. But, oh, well, I've wasted it now. I might as well carry on.
Yeah.
And luckily, nobody told me about the sunk cost fallacy at that point, at which point I might have gone, oh, yeah, I need to leave. Because at that time I thought to myself, well, cool, I've invested all this time and effort into becoming a doctor, so I may as well carry on with it and make the most of it. But how can I optimize every other aspect of my life so that this isn't making me unhappy? And so I made loads of effort to do that. And then, of course, as is natural, by the time I had done all of that anyway, I didn't hate everything quite so much,
Yeah.
because I had learned how. It's like, it's that realization that sometimes things are rubbish because they haven't got good yet,
Yes.
or because you haven't got good at them yet, you know. And actually things are changeable, and it's not necessarily that. I often find it interesting when people say that something makes them unhappy, because I'm like, why does it make you unhappy? Have you decided that it makes you unhappy and that's what's making you unhappy?
Yeah.
Is
And
your expectation different? What do you, if you reframed your expectations, would this still be making you unhappy? It's really interesting.
yeah, and I think another thing, you like you just said there, that you know, something can make you feel rubbish along the way and eventually get good. And I think this is something that is actually not explained to people in the vast majority of self-development books, is that like when jobs get enjoyable, it's generally when you have become to some degree competent enough to stand on your own and have an element of creativity and decision making,
Yeah.
etc. Because like for example, when I go out and I'm an intern as a doctor, like you're doing the worst jobs, you're doing the shittiest jobs, you're not making, I imagine you're not making very influential decisions. You know, you're not doing all the sexy diagnoses, the rare diagnoses, the rare diseases. You're unlikely to be asking, you know, medical questions that are rare or haven't been asked before, or thinking about new problems, because you don't have the level of competence yet to be able to do that stuff.
Mhm.
But when you do get there, things get more enjoyable. It's like personal training. Initially, when you're a personal trainer, it's really stressful and you're not sure about it because people are asking you questions. You know very few of the answers to their questions. You don't feel like you have your own personal craft that you're working on, because all you're trying to do is catch up and get the basic skills. But as you begin to gain competence, and suddenly you're like, okay, you know, I have the basics down. I've worked with enough clients where I feel I'm comfortable coaching most people, and now I can get creative. I can say, okay, you know, this is the way that Gary coaches. I kind of I coach like this, and I have my methods. And then you start to discuss that with other professionals, and suddenly there's creativity, there's decision making, and there's actually freedom. And it's something that it's someone who I'm a big fan of, Jocko Willink, if you're aware of him. He's his phrase is discipline equals freedom, and that you have to be able to put in discipline for a long period of time before you actually access that freedom that is available. And that goes for medical school. You know, it's like you're learning all this boring stuff. You're learning the biochemistry, the pharmacology, the pathology, etc. It's all this boring stuff, but it lays the foundation on which the later capacity for decision making and creativity and enjoyment of your job, where that actually comes. And on the point of this discussion, If someone comes in the middle of that process, just when it's at its worst, let's say third year medical school, you're super stressed or whatever, someone comes in and says, hey, here's a self-development book that'll teach you how to be happy every morning you wake up. Like, you're being given another path there that's very, very tempting, but may
Mm.
not be the best path long term. It mightn't get you to the point of being happy Dr. Mike II, the experienced GP, happy out with life now.
Yeah, it is interesting. It's very sliding doors, isn't it?
Yep. There's no single way.
Yeah, exactly.
So yeah, I think that covers most of what we wanted to discuss, and definitely
Yeah,
some additional tangents.
pretty much everything in the world.
Yeah, we discussed, morality, religion, medicine, etc. But actually, one question to finish off, just because you have the expertise and I'm the minion. But what advice? Because maybe some people in my class will listen to this. So, as an experienced GP, what advice would you give to someone who's currently in medical school? And two, would you sell GP to them, and if so, how?
The advice I would give is to really kind of like envelop yourself as much as you can. So like when you do attachments as a medical student, it's very, very easy to be like on the periphery, to see these people working as doctors as like, oh, I shouldn't really bother them. I should just stand in the background and watch. But try and learn as much as you can. Like, try and expose yourself to as much as you can. Like, speak to patients, present patients, like do all the stuff that just makes you feel a little bit icky and uncomfortable. Because actually, once you qualify and once once you are sort of, even as a more senior level as a doctor, you kind of realize, God, it's so weird thinking that I'm the one that these medical students are coming and shadowing now. And they probably think that I'm really busy and important. And actually, I'm just exactly the same person that I was in medical school, just bumbling around trying to figure stuff out. And actually, like, if you become part of that team, you'll learn so much more. So I think it's just like, be a little bit annoying, like that. Give yourself license to just be a little bit annoying and just get, but be nice. Be nice to everybody, and be helpful. And that will be a really good way of like actually understanding a bit more about what people do when they work in that job. Because this is the one thing that you'll never get as a junior doctor. You like it, well, no, you do in general practice. So like, if you do a junior attachment in general practice, it's a fairly reasonable assessment of what it's like to be a GP. The workload is a lot less than when you're an actual GP, but you kind of see, this is the kind of patients you'll be seeing, this is the kind of stuff you'll be expected to do, these are the kinds of questions you'll be expected to answer. Whereas, like, to use orthopedic surgery as an example from before, when you do orthopedic surgery as a junior doctor, you don't get to spend that much time in theatre because you're too busy organising the patient list, seeing the patients, doing the ward rounds, getting the blood test done, all of those sorts of things, like to help the organisation and the running of it. Whereas when you're a medical student, you can go to theatre, you can assist in surgeries, you can actually try and shadow the more senior members of the team to try and figure out what it is that they actually do day to day, so you can think more about what you're going to do in your career. In terms of whether or not I would sell general practice, I would never sell anything. I think if it needs to be sold, then it's not the right thing for you. But what I would do, what I would say to people, I think the biggest misconception about general practice is that it is the kind of job that you can do if you just haven't really managed to do the other things that you actually want to do. General practice, if you don't love it, is a terrible, terrible, terrible career choice, because if you don't love it, chances are you won't be very good at it, and it will make you miserable, because it's not the 9 to 5 carefree tea and biscuits type of ideas that people used to tell us that it was. Because I think there was a period of time when I don't know whether it ever was like that, but certainly that's what they used to tell us. And it's a great job. It's an incredibly privileged job. Like, you get to speak to people all day. So if you like people, it's amazing. If you like variety, it's amazing. And you have, and I think this is, sorry, I'm rambling now, but
No, go ahead.
medicine as a career, like you said before, but being a doctor means millions of different things. Like, I think the most important thing that you can recognize is that the world is your oyster. A medical degree gives you the power to do so many different things that actually, even if you're going through medical school thinking, I'm not really sure if this is right for me, there will be something that will be right for you within that. and it will be great. So yeah, figure out what that is. Do it if you love it. Don't do it if you don't.
Savage. Brilliant. Advice taken on board. Thank you, Mike.
Cool.
So yeah, that's the end of this podcast, guys. If people want to find out more about you, the kind of stuff you do be putting out, I'm subscribed to your newsletter, really enjoying it. So where can people hear more about Dr. Mike?
Well, Dr. Mike the Second. So it's Dr. Mike the Second at all of the social media profiles, Facebook, Instagram, Twitter, and drmikethesecond.com, where you can subscribe to my weekly email, which is just rambling, really. It's not particularly exciting, but it's something that I enjoy doing. And I'm very grateful that you enjoy reading it. Thank you very much for that.
Brilliant. So thanks everyone for listening, and we will see you in the next episode of the podcast.